Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour, mesdames et messieurs, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon, everyone. Today we have 8 new confirmed cases of COVID-19 in New Brunswick. They are all related to travel or contact with someone who has recently traveled. The cases we are announcing today are in Zone 1. We have 3 cases in Zone 1. We have 3 cases in Zone 2. 1 case in Zone 3 and 1 case in Zone 4, and I'll just go through their ages. So in Zone 1, it's an individual age 50 to 60 that's travel-related, an individual age 30 to 40 that's travel-related, an individual age 60 to 7 that's travel-related. In the southern part of the province, in Zone 2, an individual who is aged 50 to 60, that's travel-related, an individual age 10 to 20, which is travel-related, and an individual aged 20 to 30 who is a close contact of a travel-related case. In Zone 3, which is the central area of the province, an individual aged 30 to 40, which is travel-related, and in Zone 4, the northern part of the province, the northwest part of the province, an individual aged 30 to 40, and that is also travel-related. So today, I want to ensure the public that New Brunswick is testing more people more widely as the situation evolves. As we increase testing in the days and weeks ahead, we will find more confirmed cases. So far, more than 1,700 tests have been conducted in New Brunswick. As the pandemic progresses, we are modifying the details being shared. This is a direct result of concerns expressed by patients with confirmed results. We are committed to protecting individuals' privacy as required by law. À mesure que la pandémie progresse, nous modifions les détails que nous vous transmettrons. Ceci est le résultat direct des préoccupations exprimées par les patients dont les résultats ont été confirmés. Nous nous engageons à protéger la vie privée des personnes comme l'exige la loi. Going forward, we will identify confirmed cases by the patient's age range and zone of residence only. Firstly, I want all New Brunswickers to know that our influenza sentinel surveillance system is and has been in place during the flu season. And the reason I mention this is that this is a routine system and it provides us with awareness of what's happening in the community regarding influenza-like illnesses, so anything that looks like the flu with a cough and a fever. I can tell you that since the beginning of March, physicians have been testing for COVID-19 on those people with influenza-like symptoms. On March 23rd, we implemented a similar surveillance system to test patients with respiratory symptoms, such as a fever and a cough, in the emergency rooms and those hospitalized for COVID-19. On March 24th, we broadened our travel criteria for testing. As of March 24th, we have expanded the New Brunswick case definition to include anyone who has traveled outside the province in the past 14 days. This aligns with other provinces and territories such as Nova Scotia. The purpose of this is to capture a broader range of the population and to identify triggers such as community transmission. We remain focused on testing the right people to track down those with this disease and those that have come in contact with them so that we can isolate them and slow the spread of COVID-19 in our province. It is most important, more important now than ever, that we maintain that crucial physical distance from one another. So I say again, please stay home as much as you possibly can. When you do have to go out, please keep your interactions brief and stay at least 2 meters or 6 feet from the people that you come into contact with. Staying home and practicing physical distancing will save lives. It will protect our healthcare workers. It will protect our system, and it will protect our essential service workers. We are in this for the long haul. Projections by leading authorities suggest that we may be dealing with the effects of this virus for the next 18 to 24 months while we wait for a vaccine or other treatment. So we must continually adjust our strategies as the pandemic continues. Il faut comprendre que cette situation pourrait durer longtemps. Les projections des principales autorités suggèrent que nous pourrions être confrontés aux effets de ce virus pour les 18 à 24 prochains mois, jusqu'à temps qu'on reçoit de nouveaux traitements ou des vaccins. Nous devons donc continuellement ajuster nos stratégies à mesure que la pandémie se poursuit. As circumstances change, our testing and procedures and protocols will adapt. With the requirement for self-isolation for New Brunswickers having traveled outside the province, internationally and within Canada, we will be testing more people when symptoms emerge. This is why it is vital that those directed to self-isolate for 14 days do so without exception, and those in self-isolation must monitor their symptoms on a daily basis. Use the self-assessment tool at gnb.ca/coronavirus to guide your actions. If you have these symptoms, regardless of your international travel history, contact 811 for your assessment and you will be referred for testing if required. We have had many people using the GNB website and the self-assessment tool, and I think there's been over 60,000 people now. We also have a tool available at the national level, so if there's for any reason that you don't get what you need from the GNB self-assessment tool, Public Health Agency of Canada has a very similar tool, so you're welcome to use that one as well. And isolation means don't go beyond the bounds of your home. Stepping out on your balcony or deck is fine, but keep yourself away from others until the 14 days have passed. And what I mean by that is the self-isolation for people who have been instructed by a physician, who have instructed by the 14 days of travel outside Canada and outside New Brunswick. Once you have tested, you will receive your result from Public Health. Please don't call 811 for results. We need to manage the demand for this line for those who are seeking guidance. I would like to focus my remarks today on the process of testing for COVID-19 in describing how we test, who we test, when we test, and why we test. We are testing as part of our overall response to slow the progress of this disease, to flatten the curve of the infection and transmission so that our healthcare system can manage this pandemic and treat those who become ill. To date, we have conducted more than 1,700 tests, of which 26 have been confirmed for COVID-19. Our microbiology laboratory at the Dr. Georges Dumont Hospital in Moncton, where all COVID-19 testing is taking place, is keeping pace with the demand for this testing. We can process a conclusive result within 24 to 48 hours of receiving a specimen. We have the capacity to conduct 600 tests per day, and we will soon be able to process 1,000 tests every day. We are rapidly improving the speed and efficiency of our testing process. Nous avons la capacité d'effectuer 600 tests par jour et nous serons bientôt en mesure de traiter 1,000 tests par jour. Nous améliorons rapidement la rapidité et l'efficacité de notre processus de test. In a pandemic, the proven approach to testing is to first test those most likely to have the disease and those they have been in contact with. At the start, this was a narrow field because those who had traveled to Hubei province in China, where the disease was first reported, were the first people that we were testing and looking for the disease in. Our criteria for determining who is tested as follows. In the 14 days before onset of illness, a person who has traveled to an affected area or had close contact with a confirmed or probable case of COVID-19 or had close contact with a person with an acute respiratory illness who has been to an affected area within 14 days prior to the onset of their illness. As of yesterday, the criteria was widened to capture any person who has traveled outside of New Brunswick, outside of Canada to another province or territory. As the field of contagion grows, so does the testing net that we cast. We continually are adjusting our testing strategy to meet the changing shape of this pandemic. The wider criteria for testing means more New Brunswickers will have come in contact with a person who may have COVID-19. And more of you will be asked to self-isolate as a precaution to slow the spread of the disease. These measures are absolutely necessary as we confront the most serious health challenge of any of us have ever seen in our lifetimes. You may feel powerless and alone right now, particularly if you already are self-isolating. But you are not alone, and you are not powerless. You have a unique and important power, the power to slow the progress of COVID-19 and save the lives of your family members, friends, neighbors, and fellow New Brunswickers. You have the power to stay home. You have the power to maintain physical distancing, a distance the virus cannot cross. You have the power to practice good hygiene by washing your hands regularly and keeping commonly used surfaces clean. Our testing efforts will only be effective if you use these powers that are within your possession. And I appeal to all New Brunswickers, what happens next depends on you and how you use the powers you've been given. Thank you very much.
Good afternoon. Bonjour. Our government continues to take action to slow the introduction and spread of COVID-19 in New Brunswick. I want to thank those who are self-isolating upon return from travel. Please continue to do so. Notre gouvernement continue de prendre des mesures afin de ralentir l'introduction et la propagation de la COVID-19 au Nouveau-Brunswick. Je veux remercier les personnes qui s'auto-isolent de leur retour de voyage. Voilà pourquoi d'autres mesures sont nécessaires. While many are adhering to the need for self-isolation and social distancing, not everyone is. That is why more measures are necessary. As of today at 3 p.m., our province will implement restrictions for all travelers who are arriving in New Brunswick from outside this province. This will add interprovincial travelers to those needing to self-isolate, along with international travelers. What this means is that, aside from a few exceptions, all travelers entering New Brunswick must self-isolate for 14 days and avoid contact with others. À part quelques exceptions, tous les voyageurs qui entrent au Nouveau-Brunswick doivent s'auto-isoler pendant 14 jours et éviter tout contact avec les autres. By implementing screening and interprovincial borders, we hope to further reduce unnecessary travel. Border checks will be conducted at points of entry from Quebec, Prince Edward Island, and Nova Scotia. En mettant en place des mesures de contrôle aux frontières interprovinciales, nous espérons réduire davantage les voyages non nécessaires. Il y a des contrôles aux frontières, soit en point d'entrée près de Québec, des îles de Prince Edward et de la Nouvelle-Écosse. The identities of travelers will be verified, contact information will be collected, and destinations will be tracked for all travelers, including through travelers. As with the Canada-US border, commercial traffic and essential services will be exempt, so services are maintained and critical supplies continue to move across provincial lines. It is imperative that we ensure our supply chain continues to work while keeping New Brunswickers healthy and safe. Comme à la frontière entre le Canada et les États-Unis, il y aura une exception pour les véhicules commerciaux et les services essentiels afin de maintenir les services et de continuer à transporter les articles de première nécessité au-delà des frontières provinciales. Il faut impérativement nous assurer que notre chaîne d'approvisionnement continue de bien fonctionner, tout en veillant à la santé et à la sécurité des gens du Nouveau-Brunswick. All unnecessary travel into New Brunswick is prohibited, and peace officers are authorized to turn visitors away when they attempt to enter. It is recognized that some travel is necessary, including residents of other provinces who must enter to travel through New Brunswick to work or to receive medical treatment, commercial vehicle drivers delivering goods, and residents of Campobello Island entering to access essential goods or services. As well, New Brunswick residents who have been out of the province temporarily will continue to be permitted to return home. Unnecessary travel is no longer permitted. Unnecessary travel includes non-residents of New Brunswick entering New Brunswick to make or receive purchases or to visit or for other social purposes. We understand that not everyone who is told to self-isolate for 14 days has the resources to do so. That is why our government has partnered with the Canadian Red Cross to support New Brunswickers impacted by the requirement to self-isolate. The Canadian Red Cross can assist people in accessing a wide range of supports and services. Nous comprenons que ne sont pas toutes les personnes qui ont reçu l'ordre de s'auto-isoler pendant 14 jours qui ont les ressources nécessaires pour pouvoir le faire. C'est pourquoi notre gouvernement s'est allié à la Croix-Rouge canadienne afin de soutenir les gens de Nouveau-Brunswick qui vivent des répercussions en raison des obligations de ces auto-isolés. La Croix-Rouge canadienne peut aider les gens à accéder à une variété de soutiens et de services. People of issues or concern should call 1-800-863-6582. Last week, we suspended the right for landlords to evict tenants for non-payment of rent through to May 31st. We are not saying tenants don't have to pay rent. They absolutely do. We are simply asking for flexibility that may be required as people and businesses lose income, and we cannot have unnecessary moving activity. At some point, every tenant is going to need to make arrangements with their landlord concerning their rent, or they will indeed find themselves evicted, just not now through May 31st. The goal of the steps we are taking to protect the people of New Brunswick. Le but des mesures qui nous attendent est de protéger les gens de Nouveau-Brunswick. The situation we are all in is unlike any we have experienced before. We must continue to support one another as we rise to meet this challenge. The more steps we take now can help to limit the duration, but we have to do this together. Si nous prenons des mesures dès maintenant, nous aiderons à limiter la durée, mais nous devons agir ensemble. Thank you. Merci.
Thank you, Premier. We'll now proceed to questions from the media. Yeah. Nous allons maintenant procéder à des questions des journalistes. On vous demande, s'il vous plaît, silencer vos haut-parleurs sur vos téléphones ou vos tablettes. We'd ask that you please silence the speakers on your cell phones and tablets, please. Okay, the first question for Vicky Hogarth, Charlotte County TV.
Thanks. My first question is for the Premier. In what ways are you preparing for the toll COVID-19 will take on the fishing industry? And will EI be extended for seasonal workers who can no longer return to work?
Excuse me, you just have to cut in. There's feedback on the line and we can't hear the question. Someone has a feed on that is on delay. So could everyone please, that's on the line with the journalists, mute the background noise? S'il vous plaît, silencez tous les haut-parleurs ou les télévisions que vous avez alentour de vous. Merci.
Comment préparez-vous le domaine de la pêche et les travailleurs saisonniers pour les effets de la COVID-19?
Turn your TVs off.
There's someone with a TV on in the background. Could that please be silenced? Silencez tous les haut-parleurs ou les télévisions que vous avez alentour de vous. Merci. Okay, we're going to try again. Vicky Hogarth, Charlotte County TV.
Thanks, Dave. My first question is for the Premier. In what ways are you preparing for the toll COVID-19 will take on the fishing industry?
There's someone with a TV on in the background. Could that please be silenced?
And will EI be extended for seasonal workers who can no longer return to work?
Okay, we're going to try again. Vicky.
Vicky, I only got part of your question. I got the last part about would seasonal workers, would the season be extended? And I think the overarching comment to this is that anyone whose normal employment is impacted by the COVID crisis will have their benefits extended, or the EI benefits in this case, or that financial impact recognized and dealt with according to the aid package that's provided either federally or provincially.
Did you have a follow-up, Vicky?
I I did. I'm sorry. Someone does have their TV on, and I haven't been able to hear anything for this entire press conference. My second question was, why do you think the other premiers are against enacting a national state of emergency at this time? And what benefits do you think a national state of emergency would have for New Brunswickers in terms of equal access to equipment and consistency of care?
So I think it's very important that we have consistency across our country. And I think, adopting national standards, but also national protocol for what equipment's available, the standards that are protecting workers, the equipment's being used there, the protection by supply or by per capita of available supplies. I think that it's important that we maintain the very spirit of the Canada Health Act and that we have standards that are uniform, whether it's a crisis or whether it's not. I think some of the maybe the disagreement or concerns had to do more with the passing of legislation that was kind of an unfettered approach that was thrown into the mix in relation to the funding efforts or the money that the powers the federal government would have. That's not what I'm after here. What I'm after is, like what we've seen right today on a national quarantine of travelers coming in. I think we should have that interprovincial requirements that are nationally set up so that we're not just trying to see what the other one did and then move forward, or we're not taking off on an approach all our own. We're learning from each other, we're learning from other countries, and we're demonstrating the best protocol that is available. And I just believe when we focus together on that, we implement together, we end up getting better results.
Charles Camira, TVA Edmundston.
Oui. Ma première question concerne Dr. Russell. Alors, ma question est la suivante en français. Comment ça va être possible de voir concrètement parlant que la province va effectuer de plus en plus de tests de dépistage en sachant que, selon les dernières statistiques au Canada, le Nouveau-Brunswick est dernière à ce niveau?
Oui, je sais, j'ai vu tellement de commentaires là-dessus dans les médias sociaux. Alors, la question, c'est combien vraiment de tests est-ce qu'on a effectué à ce moment-ci? Combien est-ce qu'on peut? Est-ce qu'on a la capacité? Et c'est quelles les raisons qu'on avait testé le tel nombre? Alors, on suit les directives nationales au sujet du définition d'un cas et les critères qu'on va utiliser pour tester quelqu'un. Et depuis le commencement de cette éclosion, la pandémie, il y a une évolution sur les endroits du monde qui posaient un risque pour les voyageurs. Alors, ça va commencer avec la définition inclut la Chine. Et après ça, c'était Iran, Italie. Et après ça, c'était tout le monde. Et puis après ça, c'est le Nouveau-Brunswick. Alors, fur et à mesure que les critères ont changé au niveau de qui on va faire des dépistages dessus, fur et à mesure que cette information changeait, c'est ça nous aussi, on a adapté et on a changé pour être alignés avec nos partenaires, inclus la Nouvelle-Écosse. Quand on compare les résultats du Nouveau-Brunswick et les résultats, les nombres de tests à Nouvelle-Écosse et Nouveau-Brunswick, on peut voir que Nouvelle-Écosse a une population plus gros que le Nouveau-Brunswick, environ 25% de plus. Ils ont un aéroport international, alors ça se peut que le voyage était plus nombreux, les voyageurs étaient plus nombreux au Nouvelle-Écosse. On ne peut pas dire exactement la raison des nombres comme tels exacts sont différents, mais on peut vous dire qu'on suit les mêmes directives et on utilise les mêmes critères pour tester la capacité de notre laboratoire. Et là, maintenant, on teste environ 150 personnes par jour. Si on a besoin de l'augmenter, la capacité est là. Alors, on n'est pas dans une situation où la demande est plus gros que notre capacité. On peut augmenter jusqu'à 1000 tests par jour. Alors, fur et à mesure qu'il y a des changements dans les critères, comme je vous dis, on va augmenter le nombre de tests qu'on faisait.
Est-ce que tu as un suivi, Charles?
Oui, ça serait une autre question, mais envers Blaine Higgs. Toujours en français, est-ce que la province du Nouveau-Brunswick en fait suffisamment pour protéger tous les travailleurs de la santé qui essayent de combattre la COVID-19.
Yeah. I think that, en anglais, s'il vous plaît. I think the point that we've just listened to Dr. Russell talk about the testing and expansion of the testing, and I commend her for doing that because I think that as we learn more going through this process, we are expanding that on the testing side. But I think what I'd like to point out is that we have reacted very quickly on the kind of the physical restraints, the isolation program, the changes in border crossing, the issues around how we've informed the public of the manners that they need to conduct themselves to keep themselves safe. So regardless of you know, what the testing results tell us, we move forward in ways to protect our citizens, and we'll continue to do that. And the increased testing just provides more information for us to work with. So we're moving on all fronts, and I'm pleased to say that we are either equal to or ahead of many jurisdictions, and we want to certainly keep our count down. We know it's going to go up, but we want to keep it down because that would be the right thing to do and not overwhelm our health system. And that's been our goal from the very beginning.
Merci. Jean-Philippe Hughes de Radio-Canada.
Oui, bonjour. Donc, ma question est pour Monsieur Higgs. On me dit qu'à l'heure actuelle, il y a déjà des voitures de police et des employés du ministère des Transports entre sur la frontière entre Campbellton et le Québec. Moi, j'aimerais savoir quelles sont les exemptions. Est-ce que les travailleurs du Nouveau-Brunswick qui travaillent à Pointe-à-la-Croix pourront continuer d'aller travailler dans des services essentiels comme les épiceries ou encore les pharmacies de Pointe-à-la-Croix?
Okay. Merci, Jean-Philippe. Pourrais-tu répéter la question en anglais, s'il vous plaît?
Yeah, sure. So I'm being told that there are already police officers and Department of Transport officers that are on the border between Quebec and New Brunswick. My question is, what about the workers from New Brunswick who operate some essential services in Pointe-à-la-Croix on the other side of the border of Campbellton? For instance, I think the owner of the drugstore and the grocery stores and many employees are from New Brunswick, and at the opposite, a lot of workers from Vitalité in Campbellton live in Quebec. These people, are they going to be able to continue working?
Yes, they are. We would consider certainly the healthcare workers as essential services coming into Edmonton and on essential services for supplies, be it groceries or the pharmacies. The same thing would apply. So essential services and people moving back and forth because of that would be allowed to continue that.
Est-ce que tu as un suivi, Jean-Philippe?
Oui, donc j'aimerais savoir, so I'd like to know, Mr. Higgs, you've been told there would be tracking of the people getting inside the province. I would like to know exactly how will you enforce this? Which kinds of information will you collect from the people getting inside the province through the interprovincial borders?
So we're asking for information in relation certainly to the identification of the individual, their place of residence, their purpose of travel. We'll take their license number, we'll have their phone number, and we'll be following up. So if they say they're moving through our province to go to Nova Scotia, we'll want to check up on that's actually happening. Much of this is on the honor system, and we're relying on New Brunswickers to do just that. But there are always some that feel that they don't need to follow the rules. Well, when they don't follow the rules, they're jeopardizing their fellow citizens because this is a health concern that could spread and get worse unless people follow the rules. So we're tracking, and we will follow up where people are moving throughout our province. If they are going to their place of residence, we'll be following up with them to see that they are indeed isolating, because that is the requirement. So it's not just a casual meeting at the border. It's understanding exactly their point of entry, their point of exit, and their destination.
Merci. Silas Brown, Global News.
Hi there. This is for Dr. Russell. I know that you spoke at length about what is happening with testing, but I want to be sure that we're all kind of on the same page here. So I'm curious, can you tell us how many tests have been done on people who are symptomatic but have not traveled?
I don't have an exact number for you, Silas, but I can tell you that I looked at the numbers in terms of when we started actually testing, when people were actually presenting with symptoms or not. And I did speak with my regional medical officers of health this morning just to confirm along the course of the outbreak, the numbers that we have seen, that individual physicians and public health physicians have been having conversations. So when they did have somebody who was suspicious, they did actually test them. So those one-offs happened over the course of time since we started seeing people about back in around the middle of February. So around February 13th is when we first started seeing people that met the requirements and criteria for testing. So at the same time, if there were exceptions and one-offs, those would have had taken place. I can tell you that in terms of the sentinel testing and testing in the hospitals, that's being implemented at this moment in time. But certainly from the middle of February on, if there were individuals who didn't quite meet the criteria with respect to either having traveled, then those conversations would have happened with the physician and the medical health officer in the region.
Okay.
Follow up, Silas?
Yeah, so if we are, so say, if I am symptomatic and I have not traveled, can I get tested, or is that effectively just for people who are already in hospitals, or is that up to the discretion of my physician?
Actually, Silas, can you go back to your first question, because you were asking about symptomatic patients, correct? Or did you?
Yes, did I say I don't have symptoms? Sorry.
I think you might have actually, and I was sort of hearing you. I just wanted to clarify, when you were asking about people who had been tested, I feel like you were asking the question about were there tests conducted on people who didn't have the travel history, but did you, because we haven't really tested people who are asymptomatic. So I'll just clarify that.
Yeah, no.
Okay. Okay. So the second question now?
Yeah, so if I am symptomatic and I have not traveled, would I be able to be tested now, or in what situation would I be able to be tested? Is that up to the discretion of my physician, or only if I'm in hospital for some other reason?
So there's a couple of different ways that that's happening. So one, you can call 811, you can see your physician, and they can use their discretion about the testing. And then again, we have the new system in place with respect to looking for community transmission in people who are hospitalized, and the situation, people who present with respiratory symptoms in the emergency department.
Okay, so if I am symptomatic and I call 811 and I haven't traveled, there is a possibility that I could then get tested.
Technically, yes, but again, we're sticking with the criteria that our counterparts have right now around testing, and technically the criteria that we have right now is that you have to have traveled outside the province.
Thank you. Elizabeth Fraser, CBC.
Hi, my question is for the Premier. How will you be tracking, and who will be doing the tracking and following up on the people who enter the province under the new measures you announced today? And what will be the penalty if people are caught disobeying these rules?
So we're tracking using public safety officers in combination with the RCMP and other enforcement officers, but the information that we're gathering is related to their certainly their name, their contact information, their place of origin, where they're traveling to. Are they going through the province? Are they going to an address in the province? Are the purpose of their trip? Because it'll be for essential purposes. So if people are coming home, going to their house, then we want to know where that is, and we'll be checking to say that they self-isolate because they're supposed to go there and stay there for 14 days. And that we will follow up. Now, in terms of compliance or enforcement, the same rules apply to people that are not following isolation, or they're congregating, or retail stores are open that shouldn't be. There is a fine mechanism, there's a warning, there's a fine, and it could be up to $10,000.
For an individual person, it could be up to $10,000.
We will be implementing a process to ensure that the rules of public health are being followed.
Okay, and my next dealing, that we could be dealing with the effects of this virus for 18 to 24 months. Can you just paint a more detailed picture of what you're talking about and what you mean?
So in terms of what we know right now from the research and the evidence out there around projections of how long it will take to develop a vaccine or have a treatment that works, this is a virus that we don't have immunity against. And so we could throw everything in the kitchen sink at it right now and stamp it out, but it won't be gone globally. So it will keep popping up. And so places like China, where they were able to get it completely under control and eliminate all the cases, they are now having new cases of travel-related cases imported into China. And they are very, very careful about how they're managing those and isolating them. But I think overall what that means is that we have a new normal in our existence right now around the social distancing, the hand washing, being very, very careful about self-isolation when you're being told to do that. And then, you know, moving forward over time with the restrictions that we have in place right now to slow it down. We know we can't stamp it out. We know we have to wait for a vaccine for that to happen. But to slow it down for our healthcare system to be able to manage and cope with it while we wait, that's what we're going to be in a holding pattern with respect to trying to keep that part under control, balancing that with economics and society in terms of what types of restrictions can be eventually lifted. That will depend on the numbers, and it'll depend on how well we manage things now. So we know that it is possible to get things under control and keep the numbers down. Again, we just don't know how long it will take, and we don't know how low we can keep those numbers to then be able to relax some of the restrictions and then have society and economy function to a bit of a higher level than it is able to right now.
Thank you. Savannah Aud, Telegraph Journal.
Hi, Mr. Premier, we know the province has struggled to free up hospital beds with ILC patients, and given our growing elderly population and staffing shortages, how have we been able to do that now despite these longstanding challenges? And could you just tell me how many ALCs have been moved to date as well?
I think the number to date that have been moved is in 65 to 70. And and so I think, you know, we've had great cooperation between the health authorities and social development and the Nursing Home Association as we've done this. I think what it tells us is that, you know, we can look at other areas that we may want to, let's say, look at different hospitals and how do we ensure that they have, let's say, the best capability possible in the province to treat any potential outbreak of COVID-19 that requires hospitalization. And that's all part of discussions as we go forward to look at and plan, because everything we're doing is we're planning for the long haul, but we'd like a shorter duration. But as Dr. Russell states, you know, the need to be prepared, the need to be really stamp this out when there's appropriate vaccine. But we want to stay below the curve in terms of our health capabilities. And we feel there may be further need to move some of the long-term care patients into other facilities in order to ensure that we're able to provide the care needed, if needed and when needed, at some hospitals.
Do you have a follow-up, Savannah?
Yeah, sorry, just first of all, I guess a clarification on the first. Just the part about the staffing shortage, how are we meeting that added demand now that ALCs are being moved out? And my follow-up would just be, is location or family proximity going to be considered with transfers, and are they going to stay there after the pandemic response ends?
Well, I think in the situation, what we've done now is really we've implemented, and I guess the radius is somewhere around 1,000 kilometers. Sorry, 100 kilometers. My apologies. The idea of whether it'll be long term or not. We found many facilities that were underutilized. We only move people in as we're able to staff them appropriately, so no one is being put at risk by filling up beds that don't have the proper staffing to go with that. So I need to put that certainly at ease for any family members. But it is important that our hospitals are available, you know, for acute care and care as needed, especially in this health crisis. So I think what we've seen here through this process, not only implementing the kind of the choices that are available to be made to ensure that long-term care patients actually are getting the best care possible. I think we all realize that isn't really possible in a normal hospital setting, but it is certainly possible in a nursing home care setting. So being able to do more of that is right for the long-term care patient, and it's right for our ability to serve the needs of the population as it potentially ramps up. I think something else I'd like to mention is that we've seen basically a decrease in activity in hospitals and in emergency and ERs, and we've seen that, I think, over the changes in elective surgeries or changes in prioritizing what's required in hospitals. We can see more of that going forward, doing what we must in order to ensure that the health of patients and across the province are met. But the idea is ensuring that our system can manage not only today's demands, but what potentially could be future demands.
Mathieu Roy-Como, l'Académie Nouvelle.
Hello. I would love to go back on the possible penalties for people not only not following what's required at the borders, but also when it comes to social distancing. We've heard of people getting arrested in other provinces. You keep talking about fines that might come up eventually. Do we know if any fines have been issued yet, and when will the peace officers start issuing those fines, and could it go up to jail time in New Brunswick? Because so far you talk a lot about the honor system, but it seems to be only that.
Well, no, it's certainly going to go beyond the honor system if indeed that residents are not adhering to the rules. I guess we started it last weekend with doing the surveillance of communities, and basically, as I reported earlier in the week, about 764 facilities, businesses, areas, parks, such were surveyed, and out of that we saw about a 94% compliance. We've identified, let's say, the 6% that weren't, and our officers have gone back, connecting with them and telling them what has to change. In some cases it's closing down, in some cases it may be the social distancing. We will continue to ramp that up through surveillance, through identification, through warnings, through fines, and if it comes to a situation where we actually have to force someone to adhere to the rules, I would like to think that will not be necessary, but we will go the extra mile to protect citizens from each other if we have to, because we need to control the situation. We've seen great measures in some companies or countries that have flattened the curve on the growth, and they've done it through very effective means to ensure self-isolation, to ensure that people are following the rules. We have a different society here, and we value all of the aspects of our society. We also value a healthcare system that is second to none. We must protect that. We must protect that for the benefit of everyone. And so it's concerning if some folks think that they're either above the law, but other than that, thinking that they don't have to worry about their neighbors and their friends or their parents or their grandparents because they feel like they're not vulnerable. Well, I think as Dr. Russell has said in other occasions, everyone is vulnerable. There's a higher chance of risk in older people, but everyone is vulnerable, and we do not want to put people in harm's way.
Est-ce que tu as un suivi, Mathieu?
Oui, merci, Dave. So, Mr. Premier, just to be clear, no fines have been issued yet to any individuals or to any businesses so far?
That's correct, not yet.
Adam Heuris, Brunswick News.
Thank you. Premier, the federal government changed its aid package today. Canadians who lose their income as a result of COVID-19 can now expect to get $2,000 a month for 4 months. Does it change your approach at all to provincial aid? And do you have any further details on the rollout of what you announced yesterday?
So I don't have further details on what I announced yesterday, but we knew the federal package was changing today, and that's being assessed right now. So we'll look at that, because the focus for us was basically saying, okay, we want to make sure we identify the gaps, and those gaps are either filled federally or provincially, but they will be filled. And how the new rules, affect what we announced in terms of yesterday we did announce a wait period recovery there for individuals of $900, and that was to kind of get over that gap between the EI kicking in and when it wasn't. We want to make sure that everyone at home is protected, not only in their ability to stay healthy, but their ability to be financially secure, and we want to ensure they don't have to worry about that. So we'll be analyzing the federal package as of today and look at what else we need to do to complement that.
You have a follow-up, Adam?
Yes, please, Dave. Premier, the federal government also announced today that it's triggering the Quarantine Act effective midnight. So travelers returning to Canada will have to enter a mandatory 14-day quarantine as of midnight. If this constitutes a further tightening of the Canada-U.S. border, have you been given any assurances on what this means for border communities in New Brunswick?
At this point in time, we aren't under any concern that impacts unnecessarily our movement of goods back and forth across the border, or particularly with Campbell Island, the residents' ability to get to and from and back into New Brunswick. The quarantine, I think, is a good next move. To me, that kind of further strengthens the need for us to have a national strategy here that we're working together on, so that for us, who in any province who has border communities, it's important that we understand the international aspect, but we're now getting into the realm of interprovincial aspects because of what we're seeing and hotspots throughout the country. And I think if we want to try to not all be a hotspot, we want to ensure that we have the right protections in place, not only in our movement of people going back and forth across different provinces, which we're putting in place our own here, but I would much prefer to see a national view on that and kind of a collaboration there that says this is what makes sense, because I think that needs to go further into the standards of healthcare, the consistency of supply, the protection of workers, all of the things that everyone can be assured that we are doing the same and the most we possibly can for every aspect of treating this virus.
Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering how many people at this time right now are hospitalized with COVID-19, and are any of them in ICU at this time?
Hi, Laura. We have one patient who's hospitalized, and they're not in ICU.
You have a follow-up, Laura?
Yes, to the Premier. There's definitely some concern I'm hearing from communities like Hamilton about what residents across the border in Quebec and in Hamilton can now do. So can somebody from, say, Point de la Crosse come to Hamilton to get groceries?
So I understand, we'll go through some of those nuances in the community, but I would suggest that if there's opportunities for those individuals to stay in Quebec and get their groceries, then that would probably make the most sense. As you know, right now, Quebec have a severe situation with COVID-19 and the spread, and it's in the community. And I think at this point in time, I know that individual businesses may be looking at, okay, the impact, but it gets down to the same thing of let's protect what we have today. Let's do the right thing by the community, the right thing by individuals, minimize travel to and from, and get through this storm. And then we're back to normal as soon as we can, and whatever the new normal looks like. But I understand there will be some nuances that will come out of this as they're stopping people at the crossing, at the bridge, looking at, okay, what does this look like? What is this situation? That's why we're taking the data. That's why we're looking at it. And that's why we will define as we go along here, okay, is this essential? Is it not? Are there other options? Are there not? We're not going to see people, Canadians, on either side of the border that suffer unnecessary hardship here through an implementation of a program on one side of the border or another. But given all that, we want to ensure that we minimize people crossing the borders.
Danielle McCready, CBC.
Hi there. I'm wondering if you could maybe give us the test results by zone. For example, we were wondering how many tests have been done in northern New Brunswick.
I know we're going to have a map of where the cases are around the province, but I don't think I have a map right now of where the testing has been done. So I can look into that and see if that's something that we can provide in the future. But as of right now, my understanding is moving forward, we have a map of where the cases are, but I don't have a map of the testing.
Awesome. And follow-up, so I know you said that New Brunswick has 71 ventilators. How many more are you guys trying to procure, I guess, from where and by when?
So where did you get that number of 71?
I believe that you told us at one of the press conferences last week.
No, I think we had around over 160 or some.
All right. Sorry, I'm just reading a question.
Yeah, no. So with the number that I don't have the number. I know the number.
Are you guys trying to procure more, I guess, and from where and by when?
So the number that I would have said the other day in the media would have been much higher than 71, and I know that we had ordered 50% more. So I think we had like 160 and we were ordering 90 more or something like that, and it was going to give us 250 something. So those are the numbers that I would have spoken about in the media the other day. And again, I don't have the exact numbers in front of me, but those are the ballparks. So with that knowledge, again, that I've spoken about it in the media the other day, is there a clarification around those numbers that you need?
I guess we're just kind of looking at where they are coming from and when they are expected to be put in place.
So I know that conversations have taken place between the Department of Health and the RHAs around that work, so I don't have the details on that, but I guess, again, to reiterate messages that we've said before, and I don't think it can be said too often, our healthcare system has a certain capacity. Our healthcare workers have limits in terms of what we can absorb. And so all of the measures that are being put into place right now, the social distancing, staying at home, self-isolating, washing your hands if you do have to go out, staying 6 feet apart from people, having only essential workers being out there working right now and being out and about. All of these measures are put into place because we know we can't stop COVID-19. All we can do is slow it down and keep the numbers as low as possible with respect to supporting our healthcare system and supporting our healthcare workers as we go through this. We have some very, very big challenges ahead of us in the days ahead. And so I think we just have to keep focused on that end goal that we're going to be in this for a while. We're in this together, and we all want to come out the other end and be there when that vaccine is available. So we have a lot of work ahead of us, and we all have to work together to make that happen.
For whoever's running this, we have someone else from CBC who jumped on the line kind of halfway through this. If you wanted to tack her on at the end, Mia Urquhart.
Thank you. Isabelle Larose, Radio-Canada.
Oui, alors ma question est pour le premier ministre Higgs. Est-ce que les ententes interprovinciales en matière de santé entre le Québec et le Nouveau-Brunswick sont toujours maintenues parce qu'il y a plusieurs Gaspésiens qui fréquentent l'hôpital de Campbellton? Il y a des ambulances gaspésiennes qui se rendent chaque jour à l'hôpital de Campbellton. Est-ce que tout ça est maintenu?
Est-ce que tu peux répéter en anglais, s'il vous plaît?
Est-ce que c'est possible de traduire de votre côté?
Il faudrait répéter la question.
Est-ce que les ententes interprovinciales en matière de santé sont maintenues? Parce qu'il y a plusieurs Gaspésiens qui fréquentent l'hôpital de Campbellton. Il y a plusieurs ambulanciers de la Gaspésie qui vont systématiquement à l'hôpital de Campbellton en raison de la proximité géographique. Donc, est-ce que tout ça est maintenu?
Est-ce que tu peux le répéter en anglais, s'il vous plaît?
Bon, je vais faire de mon mieux. Je pensais que le Nouveau-Brunswick était une province bilingue. Alors, is the interprovincial agreement in the health sector are still there? Because many people from the Gaspé coast are going to the hospital. Many ambulance goes every day at the hospital of Campbellton. So is those agreements between Quebec and New Brunswick in the health sector are maintained?
Yes, they're all still in place. Nothing changes for urgent care or hospital care. It would be all considered essential service.
Est-ce que tu as un suivi?
Oui, est-ce que les Madelinos qui doivent passer par le Nouveau-Brunswick auront accès, ce sera considéré comme essentiel?
Est-ce que tu peux répéter en anglais, s'il vous plaît?
are the people from Magdalen Island who has to go through New Brunswick will be authorized to pass the border to go back home?
Yes, we'd be identifying through travelers, and if their destination was passing through, they would be allowed to keep on going through to their home.
See, Kevin Bissett, Canadian Press.
Yeah, Premier, people on Campobello Island say they've written to you to say that they do not want to travel into or through the United States to get supplies and gasoline. And they're suggesting that the province perhaps arrange a boat or a truck to replenish their needs. Are you considering that?
Well, I guess as we go forward, we can consider a lot of things, but right now we're able to have movement through as they've always done from Campobello Island right through to St. Stephen, and they can travel through there without stopping at all. So I don't think that at this stage we see any particular health risk to that. I mean, if they do not want to stop in Lubec or get groceries in Lubec, that's obviously a personal choice, and I can understand that. But they're able to get back into New Brunswick, and we'll always ensure that's possible, whether it be for essential supplies, whether it be for healthcare concerns. We will ensure the residents have movement and can get back into New Brunswick. And right now, we feel they're able to do that.
Do we have a follow-up, Kevin?
I do. It's sort of a two-parter, but with that, if they were to make the trip into, say, St. Stephen to get their gasoline and get supplies, and they go back to Campobello Island, would they have to self-isolate for 14 days? And the second part of that question is there any movement at this point on getting a year-round ferry for the island?
They wouldn't have to self-isolate, in my understanding, because they would have a transit to go right directly through Maine back into New Brunswick and on the island. So that wouldn't be an issue. And at this stage, we're not looking at a year-round ferry. The usage, I've talked to many residents in this regard, would not support that. But in this situation particularly, whether the opportunity exists to have the ferry service start earlier or not, we are exploring that.
Stephanie Sirois, CHSJ.
Yes, thank you. My first question is for Dr. Russell. You mentioned that there may be an 18 to 24-month timeline for COVID-19 to play out in the province. I'm wondering if there's a way that you'd be able to set up what would need to happen medically in regards to testing or vaccines or medical equipment before it would be considered safe for immunocompromised people to be in public again.
Well, I think overall, in terms of, the measures that are in place right now, I don't think anybody expects them to be the solution for the long term to last until a vaccine arrives. I think the goal in the short term is to see these measures have an impact in the immediate weeks ahead, and then if they have a really positive effect, then we can look at relaxing some of them eventually. And as the Premier said, it would be good to have an approach nationally for that. With respect to immune-compromised people right now, I think there are vulnerabilities there, and I think that I have actually understood that there are conversations around people who are working or not wanting to work because of different conditions. So I think those are conversations that we can definitely have moving forward around what does this new normal look like for everyone in the population? What does the new normal look like for vulnerable people, whether they have an immune-compromised system or other healthcare issues?
Do you have a follow-up, Stephanie?
Yes, I do. Thank you, Dr. Russell. This question is for Premier Higgs. I know that there's currently a helpline set up with Red Cross for residents and visitors within the province. I'm wondering, is there anything else that's being done for non-permanent residents, landed immigrants, or foreign workers within the province?
Yes, we're looking at that in combination with the federal package and with our post-secondary education and labor group. Basically, as I said earlier, we're defining any gaps, and that exists with the foreign worker policy, which is a concern right now for, let's say, fish processing plants that would like to start up. Looking at areas of students, foreign students that are at universities now, with universities closed, and they're kind of locked in place at this point. Looking at students that would be coming out this year into the summer work program, that there will not be, work available. So all of those categories are being discussed both on the federal and provincial levels, so we can find a way to minimize the impact of all categories on the COVID crisis. Nicolas Steinbach, Radio-Canada.
Oui, merci. Bonjour. La question est pour Dr. Russell. Docteur, pour clarifier, est-ce que les tests de dépistage sont désormais accessibles à tout le monde ou seulement aux personnes qui ont voyagé ou qui sont en contact avec des personnes qui ont voyagé?
Alors, comme je vous avais dit tout à l'heure, pour clarifier, les tests de dépistage pour ceux qui ont voyagé et n'ont pas voyagé sont commencés dans le mois de février, environ mi-février. La plupart des gens qui ont eu des dépistages, c'était des gens qui ont voyagé, puis ça, c'était les critères qui étaient déterminés au niveau national la Santé publique du Canada. Et ça, c'est les critères que toutes les provinces ont adoptés. Et fur et à mesure que les endroits de risque ont changé de la Chine, de l'Italie, de l'Iran, de tout le monde et les parties hors de leur province, fur et à mesure que les changements ont été effectués, c'est dans ce temps-là qu'on a changé nos critères pour être testés pour les voyageurs qui ont eu des symptômes ou des gens qui étaient en contact direct avec quelqu'un qui a été diagnostiqué avec le COVID-19. Durant ce temps, tout au long de ce temps, s'il y avait des cas individuels où il y avait un médecin qui suspectait qu'il y avait quelqu'un qui il n'y avait pas les critères complètement nécessaires, mais il y avait des craintes. Ils ont parlé avec nos médecins hygiénistes dans les régions et ils ont fait des décisions que oui, on va les faire tester, même si il n'y avait pas les mêmes critères que le système. Alors, maintenant, depuis ce temps-là, alors il y avait des cas où, oui, ils ont été testés. Et aussi, maintenant, pour avancer cette semaine, on a des nouveaux critères pour des gens qui sont hospitalisés pour être testés pour le COVID-19 et aussi à certains endroits, à certains cas, dans les cas d'urgence, c'était pas dire que je veux que tout le monde va à des départements d'urgence, c'est encore 811 qu'il faut téléphoner et aussi utiliser notre site web. Mais il y a des situations où on va prendre des échantillons pour des gens qui n'ont pas voyagé à ce moment-ci pour déterminer les changements dans la transmission qu'on voit maintenant des gens qui ont voyagé à des gens qui ne sont pas nécessairement voyagés.
Merci. Oui, j'ai une relance. D'abord, une mini-précision. On m'a informé que ça prenait 24 heures environ au Nouveau-Brunswick du test au résultat. Pouvez-vous confirmer cette information-là?
C'est 24 à 48 heures.
24-48 heures. La relance, est-ce que les hôpitaux du Nouveau-Brunswick sont prêts, Dr. Russell? Est-ce que les hôpitaux du Nouveau-Brunswick sont prêts si le nombre de patients devant être hospitalisés augmentait soudainement, rapidement, comme en cas, par exemple, de contamination communautaire?
Alors, toutes les mesures qu'on a mises en place à ce jour sont vraiment... le but de ces mesures, c'est d'éviter que ça arrive comme vous décrivez. On veut absolument éviter que ce cas arrive, qu'on peut pas accepter le nombre de cas et les nombres de gens qui ont besoin d'être hospitalisés et les nombres de gens qui ont besoin d'être dans les soins ICU. Alors, toutes les mesures sont très, très, très importantes parce que c'est un impact sur l'économie, c'est un impact sur la santé mentale des gens. C'est vraiment, vraiment difficile de suivre les ordonnances maintenant qu'on donne, les directives. Et on sait que c'est difficile, mais on sait aussi que c'est absolument nécessaire pour éviter d'avoir le problème d'avoir trop de cas trop vite et notre système de santé ne peut pas vraiment gérer ce problème, ni les gens qui travaillent à l'hôpital. Alors c'est pour cette raison que ces mesures sont vraiment, vraiment importantes, sont vraiment sévères à un certain niveau, au niveau des gens pour travailler et leur santé mentale, mais c'est nécessaire pour protéger le système et éviter le cas que vous décrivez.
Merci.
Clara Pasieka from the Times and Transcript. Andrew Waugh, Telegraph Journal.
Sorry, was Clara there? Are you there, Clara?
Go ahead, Andrew.
Okay. So my first question is to the Premier. Premier, I'd like to know what changes, if anything, were made in terms of legislation to enforce these border rules. And I'd also, you mentioned surveillance in communities. I'd like to understand what that might look like, please.
So we didn't have to change anything with declaring the state of emergency. We had the authority to do that. It was something that we discussed collectively within with our cabinet committee, including the other leaders, as what were the next preventive measures that we'd like to put in place. And I have to just say that I'm very pleased with how we're working as a team together, and we're all focused on the same thing, and that's the health care of our citizens, and we're all focused to do what's necessary to ensure we minimize the risk. So that was all that was required in the sense of with the state of emergency declaration that was made a week or so ago. So that's the case in that sense. And as far as the surveillance, we did that over the weekend, following the request and the state of emergency when it turned from a request to a requirement. And we wanted to see how many businesses, how many individuals, what was the general mood. Now, we're seeing a lot of empty streets. Obviously now it's enforced even more with the close down of restaurants and then looking at businesses that are providing groceries and things and pharmacies, but other than that, closing down, and then ensuring the social distancing spaces are followed. And I mentioned that we had surveyed about 764 businesses and about 94% compliance. So we have contacted the 6%. They've been visited, and now we're following up, not only in those, but also looking at other areas. And we will continue to do that with a series of, let's say, enforcement criteria to ensure compliance.
Do you have a follow-up, Andrew?
I do, thank you. And it's actually to Dr. Russell. Dr. Russell, bit of a two-parter as well. First of all, have any healthcare workers tested positive? And secondly, today you kind of announced that due to privacy concerns that we're going to get less information about patients. There's a clause in the Right to Information and Privacy Act that specifically talks about a legal need to disclose information if there is a potential harm to the public. What advice do you seek, and how is COVID-19 not classified as a potential harm to the public?
So I'm having conversations with our privacy commissioner around what we can disclose and what we can't disclose, and I'm not saying that the definitive answers are finalized right now around that. I just recently did have a complaint from a patient whose identity she felt was compromised in terms of the information that we did provide. So out of sensitivity to that complaint, we're just sort of holding back right now while we have more discussions and really get a good sense of what information the public actually needs in this situation, while again being sensitive to the privacy concerns. But I hear exactly what you're saying, and obviously again it's that balance at this point in time as we move forward. And again, with respect to a healthcare worker, I don't have information around specific cases being healthcare workers or not. The information I have right now is whether or not they were hospitalized, whether they were a traveler, and whether or not they were a close contact of a traveler at this point in time, their age and their gender. So I have been providing that information up until this point in time, But I will be having more conversations with the privacy folks around what is appropriate for all the reasons that you mentioned, and also for the purposes of protecting people's privacy moving forward.
Thank you. Mia Urquhart, CBC.
My first question is for the Premier. What's the scale of the layoffs in New Brunswick, and when and how will those workers be able to access the $900 payment you announced yesterday?
So at this point, I do not know the exact number of layoffs. Many businesses are, repositioning people to work from home. Some are absolute layoffs, but we're working through the disbursement fund, as I mentioned, with using the Red Cross. It's available immediately, like we're targeting the next week, starting the first of the next week. But we're set up to go with Red Cross. We believe that in their process, with us reimbursing them, they have the capabilities through their reaction to emergency measures and getting to people and the connection to those most needed at the time. Also, we have a call-in numbers. We have the call-in numbers that are available for people to access. So as those numbers are accessed, and through our GMB website as well, we are set up to respond very quickly to anyone who calls, so we can identify their situation and get money directly to them.
Did you have a follow-up, Mia?
I do. St. John is back to a single testing center after two others were set up and then abruptly closed. This has caused confusion and concern and has one city councillor questioning whether a firm plan is in place to deal with the testing that will be required. What can you tell us about the decisions behind these changes, and what reassurances can you offer?
I think at this point in time, I can hear how this can be confusing and frustrating, and I can acknowledge that. But the RHAs have really been the folks that have been rolling out the testing and screening sites. So I would suggest that you ask the questions to the RHA involved. So Horizon would be the one to direct your questions to.
Thank you. And Clara Pasica from the Times and Transcript.
Hi, good afternoon. Premier Higgs, we're hearing that some provincial inmates have been released in light of COVID-19. Is this the first phase of a larger plan? And if so, how many more will be released and when? And what criteria is being looked at when these decisions are being made?
So we probably ought to have an answer for public safety on that, and I can get more information in regards to the criteria of how many have been released and what the obligations are for anyone who's been released and how they would be tracked. So that would be done again on a health basis, so we can ensure that people are actually being able to be protected and have the social distancing and the isolation criteria met. But I would reserve that question, and we could get more information from public safety for tomorrow.
And did you have a follow-up, Clara?
Yeah. Okay. For inmates not being released, the case of COVID-19 has already been detected in correctional institutes in another province. We've heard that Ontario is giving inmates cell phones so they can access social and mental health supports while maintaining social distancing. What is New Brunswick considering for those who are going to remain incarcerated? Any changes coming their way?
I think I would respond in the same way as I did the previous question, is to get you the criteria under which public safety would be operating, to look at how we would provide surveillance and how we would look at meeting the health requirements. So I'll take that commitment to provide that to you.
Okay, does perhaps Dr. Russell have any concerns or things that she'd be looking at in light of this population? Any advice or anything like that?
At this time, we have worked with our mental health and addictions folks as we approach our response. This particular issue I haven't had discussions around, but definitely if I find out any new information about that moving forward, I can definitely share that with you. And just to come back to the question around the clinics in St. John, my understanding is that there have been assurances given to folks in St. John that if their testing needs can be met by the testing site that is there.
So that concludes today's update. Thank you very much, everyone. Ceci met fin à notre mise à jour. Merci tout le monde.